request for this video, and it's something that's been on the Nclex recently that I didn't think would, but it actually is. I'm going to tell you exactly what you need to know about IVs and complications, so make sure you watch this to the end, like, save, share this out. I'm going to tell you exactly what you need to know. No more, no less, no fluff. Let's go. If you get confused between the difference between phlebitis, infiltration, excavation, or a hematoma, I'm going to let you know the difference. You need to think what is leaked, where it's leaked, and what is being damaged. Phlebitis is where the vein is inflamed. It gets irritated, it gets inflamed. The blood flow is disrupted, usually caused by mechanical irritation. So maybe the catheter is too big that you used. It could be a chemical irritant like a hypertonic solution or an antibiotic irritated it, or it could be a sign of infection. What you'll usually see is warmth, swelling, redness, pain along the vein. Sometimes it'll be elevated and palpable. What I want you to remember is this is not a rupture. This is just inflammation of the vein. So no fluid has actually leaked out. What I want you to do is remove the line and put a warm compress on it. Whatever you're administering is in the tissues, not in the vein. So the IV might have gotten dislodged and now fluid is going outside of the vein into the surrounding tissues. What you'll see is it'll feel cool, it'll feel pale, it'll be swollen. Infusion might have slowed down or just stopped. And the patient might say it feels tight. This is when you have IV fluids. The IV fluid is not damaging. Your priority is to stop the infusion, go ahead and pull that IV out and elevate that extremity. Excavation is the same thing as infiltration, but excavation is damaging because the fluid or whatever is being administered is damaging to the tissues and it is leaking out into the surrounding tissues because it was dislodged. It can cause tissue necrosis. So what you'll see is severe pain, sloughing, blistering, burning at the site. Priority is to stop the infusion, but do not take that IV out because they might need an antidote first. Hematoma is just what you think it is. The vein has either been punctured or it's been ruptured and the blood is leaking into the tissues. This often happens because poor pressure applied when the IV is removed, or that patient could be on anticoagulants, or they could just have a fragile vein. What you'll usually see, a lump, bruising, and swelling. The Nclex tip is this is blood. This is not fluid. So you can remove the IV, you can apply pressure, and you can apply ice. A little fast memory trick. Phlebitis is an inflamed vein. Infiltration is fluid in the tissues. And extravasation is where there is toxic leaking into the tissues. Hematoma is blood in the tissues. That's all I have for right now. I hope that simplifies it for you. If you want more information and tips and tricks on your Nclex so you can be successful in passing, go ahead and see the top of my page or comment down simply Nclex and I'll send you over all of the information and tag a nursing buddy. Save, like, share this out. Love you guys and happy studying.